I'm Lizzy Lovinger. I use she, her pronouns. I am the U.S. and Global Health Policy Director at Treatment Action Group, which is an organization based in New York City, and I am based in Washington, D.C. PEPFAR has played a really crucial role in building up health systems just overall, and continuing to do so. And one of the main accomplishments over the past 20 years that comes to mind is that there was a real opportunity to roll out TB preventive treatment for people living with HIV, and PEPFAR played a really pivotal role in rolling out TB preventive treatment and making sure that it was also affordable. And when PEPFAR sort of said that they would purchase particularly 3HP, which was the shortened TB preventive treatment from the previous 9-month treatment, much easier to tolerate this new regimen, and much better for people living with HIV. When they sort of set their price, that actually led globally to greater access, because that was sort of seen as the sort of global standard at that point. And I hope that in the future they continue to increase access, and that we really continue to see that in the program going forward for even more populations. This has also been really critical as we've sort of seen that one of the diseases hit hardest by the COVID-19 pandemic and the effect that it had on health systems and healthcare was TB. And PEPFAR really made sure that people living with HIV being reached by PEPFAR continued to receive TB preventive treatment, even in the context of so much disruption. And what we're really hoping is that they can continue to do so, even for something like diagnostics. The biggest sort of gap in the care cascade for TB is diagnosis. And COVID-19 has made this far worse. It's really widened the gap in diagnosis, especially for people living with HIV. And so what we're really hoping is that as PEPFAR continues to address COVID-19's impacts on people living with HIV, that we can continue closing that gap and increase access to diagnosis and care. So in 2020, 1 in 4 people living with HIV who developed TB died of TB. And that's an unacceptably high proportion of people who are dying unnecessarily of something that's preventable and treatable. And this is the case not just for people living with HIV themselves, but their household members, their family members are at increased risk. And so these are the key populations, the vulnerable populations that PEPFAR serves and really makes sure that they're saving lives. And so we hope that can continue to increase and they can continue to reach even more people who are impacted by HIV and TB. PEPFAR has been able to do amazing work with the people that they've been able to reach, but they're limited in the number of people that they're able to reach and the countries that they're able to serve. And so with additional funding, with more robust funding, we would, as I mentioned earlier, actually save more lives. We would be able to reach people and treat and cure them of TB infection and TB disease. We would be able to keep people on antiretroviral therapy and be able to address the needs of their family members and their household members as well. And so this could really make the difference, a life or death difference in people's lives if we were able to provide more funding for PEPFAR. If people aren't getting necessary access to TB preventive treatment, and they're a person living with HIV and they don't have great access to care outside of PEPFAR programs, they likely will die. And that is a very real consequence for millions of people throughout the world. Every year we see around 1.5 million deaths of TB, and an unacceptably high proportion of those deaths are people living with HIV. So we have to continue funding PEPFAR, and we have to increase funding as we go forward.